Hi everyone, welcome back. We'll be continuing on in our process, and today we're going to be starting the physical exam. My name is Monet. I'm currently an M4 at Loyola School of Medicine. So let's get started. All right, so I just want to talk about transitions. So first off is telling your patient I'm going to do a physical exam. So physical exam, if you remember from previous videos, exam is al-fahs, and then physical exam would be al-fahs as-sariri. And then I am going to do, or I am going to start, you would say rah abda. So overall, it would be rah abda al-fahs as-sariri. Next up, please change into your gown. Please is min fadlak. Change is ilbis. And then gown, or I guess you can say the general term for clothes is thobe. And then specifically for a hospital gown, you'd say thobe al-mashfa. So, min fadlak ilbis thobe al-mashfa. Please change into your hospital gown. All right, continuing transitions. So, please lay down. Again, please is min fadlak. And then lay down is tastah. Min fadlak tastah. Sit down, again, please is min fadlak. Sit down is iljis. Iljis. Or I guess you can say ijlis. Sorry, I misspoke that. So please sit down is min fadlak ijlis. Please stand up is min fadlak for please. And waqaf or uqaf, depending on your dialect. But please stand up is min fadlak waqaf or min fadlak uqaf. All right. A lot of these terms we've covered in the past, but to specify it when you're actually doing the physical exam, when you want to say your, you basically add like ek to the end of whatever word you want to do. So I'm going to examine is rah afhas, and then each term that you use, you would add just ek at the end. So blood pressure, if you remember the word for pressure is dacht. So your blood pressure would be dachtak. So to say I'm going to examine your blood pressure, you would say rah afhas daghtak. Same thing with heart. Heart is qalb or alb. So qalbak, rah afhas qalbak. Same thing with lung sounds. So ri'atinak, those are your two lungs. And then abdomen would be batnak. Rah afhas batnak. All right, more examples. Strength is kuwa or kuwat. So in this case, it would be kuwatak for your strength. So I am going to examine your strength would be rah afhas kuwatak. Ears are adan or adan. So adanak or udanak, your ears. And then eyes, plural is ayun. So your eyes would be ayunak. Overall, if you want to say I'm going to examine your eyes, rah afhas ayunak. All right, next up is just some general terms that you kind of hear a lot or when you do certain physical exam maneuvers. First off is relax your muscles. Muscles is adalat. So that's how you say muscles. Your muscles is adalatak. And then relax is irhi. So relax your muscles is irhi adalatak. And then does this hurt? So that's a general question I'm sure you've had or heard of before. This is head, and then remember the word for pain is waja. So to turn it into the verb, you would say biwaja or biyuja. So head biwaja or head biyuja. Or does this hurt? And then follow my finger. Finger is isbai. So my finger is isbai, and then follow would be ilhaq or ilhaq isbai for follow my finger. To get your vitals, for example, when you're doing blood pressure and you want to have them roll up their sleeves. Irfa is roll up or lift up. So irfa, and then akmamak is your sleeves. Irfa akmamak. I'm personally Egyptian, so you would say like kumamak. That's a common word to say too. But overall, irfa akmamak if you're using the modern standard Arabic. Again, blood pressure is dacht. If you want to tell them if it's high, good, or low. If it's high, you would say ali. If it's good, you would say جيد. If it's low, you would say واطي. So your blood pressure, remember, ضغط is blood pressure. If you want to say your blood pressure, it's ضغطك. And then we go say, if you want to say your blood pressure is high, you would say ضغطك عالي. Or ضغطك جيد, or ضغطك واطي for low. All right, moving on to lungs. So I usually would just tell people to breathe normally. So breathe is, I guess, breathe or take a breath is خد نفس, خد نفس. And then عادي. عادي means normal. So overall, breathe normally is خد نفس عادي. To take a deep breath, so same beginning, خد نفس, and then deep means عميق. عميق. خد نفس عميق. Inhale in modern standard Arabic is shahik, and then exhale is zafir. Shahik and zafir. For inhale and exhale. Okay, now moving on to strength and movement. To move your arms or legs. So if you remember from past videos or past sessions, leg is rigl or rijl, and arm is dra. So if you want to say your leg, you would say rijlak. If you want to say your arm, you'd say drak. So move means حرك. So move your leg would be حرك رجلك. If you want to say move your arm, you'd say حرك دراعك. Okay, so same words for body parts, رجلك and دراعك. So stretch means med. So stretch your leg, med رجلك. Stretch your arm, med دراعك. Okay, next up is squeeze my fingers. So squeeze is اضغط. اضغط. So that literally means apply pressure. If you remember the word for blood pressure, for example, is ضغط. So اضغط is sort of the command version of, add pressure, squeeze. My fingers, you would say أصبعي for plural. So squeeze my fingers is اضغط أصبعي. Or اضغط أصابعي. And of course, always remember to be polite. You've got to have good bedside manner. So just some words to use. Shukran is thank you. I'm sorry is أنا آسف. أنا آسف, that's if you're a male. If you're a female, you'd say أنا آسفة. It's another gendered word. And then we are done means خلصنا or خلصنا. We are done. All right. This website that we found was pretty good about physical exam words. So there's just other common terms that you want to use. We really only covered the most common ones and gave some examples. Then, of course, as always, feel free to reach out with any questions or comment down below. But thank you so much for tuning in.